They doing this Sofwave before they do surgery because their skin is a lot better, in a lot better condition to handle
Yes.
the trauma of surgery.
If you've heard of the Longevity Bible Lifespan by Professor David Sinclair, you know that living well is more important than just living long. In fact, this show is dedicated to the science of beauty, wellness, and longevity. That's why I'm so thrilled to partner with Melrose Future Lab for Season 9 of the Ageless Radiance Club podcast. Future Lab is Australia's first supplement range focused on extending not just your lifespan, but your health span. Available exclusively at Chemist Warehouse, these affordable and science-backed supplements are the key to aging well. Welcome to a great episode where we learn about the innovative world of non-invasive aesthetic treatments with Dr. Joseph Hkeik, the founder of All Saint Clinic and a trailblazer in holistic regenerative medicine and aesthetic procedures. With 25 years of experience, Dr. Hkeik brings a wealth of knowledge about the latest advancements in skincare technology and combination therapies. Today, we're focusing on Sofwave, a cutting-edge ultrasound technology distributed by Hkeik Medical in Australia. This technology promises visible skin lifting, tightening, and rejuvenation without the downtime associated with invasive procedures. We'll explore how Sofwave's unique superb technology and Sofcool cooling system work together to stimulate collagen production at the mid-dermis level, offering patients a premium experience with immediate return to daily activities. Join us as Dr. Hkeik shares his insights on how Sofwave stands out in the world of cosmetic rejuvenation and cosmetic enhancements, providing a natural lift that's making waves globally. This episode is in partnership with Hkeik Medical.
Look, the world is painful as it is on its own, so why add more pain to our world? I've always believed in really minimizing pain or getting rid of pain completely. But this technology, it surprised me how painless it was to undergo a treatment. And there's a reason, there's a scientific reason why. It is a scientific reason why it is so painless or really uncomfortable, but not painful, if I may say. And I think we need to adopt technologies that can provide this to our clients. Our clients are busy. They live in a hectic life, and we can't add more pain to their days, but we want to give them results. And this is one technology that actually ticks all those boxes from every aspect.
What is the technology specifically?
It follows what we call the acronym SUPERB, which is synchronous ultrasound parallel beam technology. And what it is, it's actually laying down ultrasound columns right on the dermis, at that very superficial endodermis where we want the dermis to actually tighten. And you're avoiding getting deeper into the skin where you're targeting the fat cells. So therefore, the people that are worried about losing fat from their skin, if they're already slim in their face, this technology is super controllable, that we can target the dermis and not the fat. So we're not going to be losing fat and making their skin really sag instead of firm. It will firm their skin for them.
And it is a collagen-inducing treatment as well. So not only
scientifically, yes, scientifically, it has been proven to produce collagen, elastin, and hyaluronic acid. What more can we have? It's an old thing that we always say: you can't have your body, or you can choose between your body and your face. And look, I think you can. You can exercise moderately. And then, of course, with the right help, you can preserve your face. You can keep your face looking the same for as long as you choose to. But to go back on topic, as we lose elastin and collagen from here and then your face falls down, we start to notice that the nasolabial fold is becoming more prominent. But also, we notice that the jawline is not as sharp as it used to be. And
you get that little lump there.
Yes. And that's because as the skin falls down, of course, there's all the ligament that stops it from falling further. As a result, you want to end up with everything on your chin because there's ligament that stop you from falling any further. So the technology, as it tightens, will do exactly what people do with their hands, but it does it slowly. You don't lose collagen and elastin overnight. It takes years to lose those. To produce more collagen and elastin is also a slow process, but it won't take years if we stimulate your skin with the right technologies and if we feed your skin the right ingredient. So what I'm trying to lure here is this: You don't just do a treatment like Sofwave and you say you expect everything's going to be fantastic. You need to still address your face by applying the right skincare, by getting the right facial, by getting the right laser technology, but also by including Sofwave along these modalities. You're going to get much better results.
I know Wave is huge in Asian and particularly Korean markets, and they are very, very advanced in their adoption of technology. And also the other thing that's huge in Korea, and I know that, you have great experience with polynucleotides and other regenerative medicine, is that they do that combination therapy.
And Baha, what you just really told me is that your journey is not set in concrete. When you start an aesthetic journey, no one has to think that what we wrote at 10 years ago is what you're going to be doing the following year and the following year. This is a journey that we design together. And then depends on your needs, depends on your concern. That journey needs to be modified to address what you want to achieve. Because even people that have severe laxity issues and they're considering surgery, and what we've learned from our colleagues in the state, like Dr. Doris Day and the like, and I love her work, by the way, they doing this soft wave before they do surgery because their skin is a lot better, in a lot better condition to handle the trauma of surgery. And then the results are far superior than if you don't do the soft wave. So to answer your question, everyone is a good candidate. It doesn't matter where you are on the scale of elasticity loss.
I'm wondering if you could speak to your philosophy around holistic beauty.
It's very important to assess each patient individually through a consultation to firstly understand their concerns, and secondly, for us to understand these changes in the anatomy that have caused these concerns. So I think these two need to make sense.
Ready to meet your best self? FutureLab supplements available exclusively at Chemist Warehouse give your body what it needs to stay strong, radiant, and ageless. FutureLab's longevity trifecta, NAD+, berberine, and resveratrol work to support the hallmarks of aging from the inside out.
And then as a physician, I need to actually understand that if someone's complaining about something, that I can find a reason why this is happening. Because I need to understand, is it an emotional or is it actually physical? And I always ask this permission, as says, allow me to describe what I'm seeing without any emotion. I ask permission to do that because I need the clients and the patients to see what I'm seeing as well. Because there need to be honesty, there need to be a truth about what I see. I need to relay this information back to each person so they can understand what is going on. And eventually I can delve deeper to find out, why is it happening? Is it menopause? Is it perimenopause? Is it weight loss? Is it something else? So just, it's not enough to actually identify what it is. You need to find the reasons why this is happening, because addressing your face, not addressing the cause that have brought you here in the first place, I'm not doing my job correctly. So this is part of the holistic approach, is to really care and really delve deeper into everything that we deal with to try to find what is it, what's caused it, what can we do to prevent it or make it better? And then what solution do we have in our bag to provide you with this to get you better and then stop it from becoming worse? Now, if we ask about the anatomy in here in the lower face, I mean, for women specifically, men will endure some of that, but much later. I think there's benefit in doing the technology more often, but I'm always really weary of prescribing things to my clients because I want them to get the best results. But also, to be fair, I don't want people to also sometimes spend too much money unnecessarily on things. I'm aware of where people are in their lives, and then so I'm not going to just base it purely on them spending money. But I think if you do it once every a year, I think is good enough. If you're really concerned, you want to catch up, there's no harm in repeating it more often, like every 3 months or every 6 months.
What does Sofwave give men? So, obviously we've talked a lot about a female face and what they might go through in different stages of aging. But does a device like Sofwave give the same results, an impressive kind of lift and firming and treatment of
Yes.
those areas?
Yes, look, skin is skin. It doesn't matter what is the color of your skin, where you come from. It really doesn't matter. Even doesn't matter if we're treating your skin of your face or the neck or the chest, and eventually the body, because Sofwave you can't treat body with, and it's been shown to
Everything.
improve the appearance of cellulite, which is really an exciting thing for us, because we've been struggling with these concerns for our clients that we haven't had a strong solution. But men equally will lose elasticity. It will happen at different times in their lives. And because men don't go through the equivalent to menopause at certain age, they also have loss of elasticity. And some of them will happen earlier, either because of illness or because of extreme exercise and fat loss, etc. And so it will actually address the same thing that women are complaining about. 25 years ago, I went to the States and I studied mesotherapy and brought it back to Australia. But at the time, it wasn't popular for many reasons. One, social media was not around. Two, it was all about regenerative medicine. And then if you look back in history, French women have been practicing mesotherapy or regenerative medicine since the 40s. Hence why they always had great skin, despite the fact that they could smoke, despite the fact that they were, living different lifestyle to us in Australia. They always had good skin. And then 25 years ago, I could not make anyone undergo treatment, because you did the treatment and they didn't see any difference visibly within after the treatment. So they really felt it was a waste of time. Move forward 25 years on, and now everyone's talking about regenerative medicine. So sometimes it's our attitude toward things that help technology to actually become part of the mainstream.
You're listening to the highlights edit of a longer episode. If you enjoyed this clip, be sure to download and listen to the full episode.